Welcome to Dr. Warrick's podcast channel. Warrick is a practicing cardiologist and author with a passion for improving care by helping patients understand their heart health through education. Warrick believes educated patients get the best health care. Discover and understand the latest approaches and technology in heart care and how this might apply to you or someone you love.
Hi, my name is Dr. Warrick Bishop and I'd like to welcome you to my podcast and videocast station. And today I'm absolutely delighted to have as a guest from the other side of the world, but previously from this side of the world, Angela Hartley, who's a registered nurse with a strong interest in cardiac rehabilitation. Welcome, Angela. How are you?
Thanks. Thank you for having me.
So, Angela, obviously, as we were talking about before, you were trained in Australia, but you've ended up back in the United Kingdom. Tell me how your training led you towards cardiac rehabilitation.
Well, I did all of my nursing training in Australia, always in cardiac, which I loved. Even as a student, just did cardiac. Worked in Brisbane, one of the big hospitals, did all my training there. And then when I moved to the UK, just for a little working holiday, while I was waiting for my nursing registration over here, which takes about a year, I worked in a gym, and I'd never previously worked in a gym. It was just an easy way to get going in the UK. Then when my registration came through in the UK, I worked in some cardiac wards for a few months, and then into ICU and recovery, and always in cardiac, so still kept up with all the heart patients. And then after a couple of years of doing that, a job came up in cardiac rehab, and I thought, why not combine the two? So to combine the exercise and the nursing, which is the perfect job for me.
So I understand that you're now running your own cardiac rehabilitation business, which is exciting. So what's the passion for you about this area of medicine? What would you say makes you passionate about cardiac rehabilitation?
Well, the reason I set up the business about doing cardiac rehab is I found that there was a real gap from when people went home from hospital after a cardiac event. So if they'd had a heart attack or a pacemaker put in or any cardiac surgery, there was this big void. And whilst many people in the UK do get entitled to cardiac rehab, which is once a week for between 6 and 8 weeks, I found that after that they felt really left out in the wild, and they didn't have that support network afterwards. So I'm sort of trying to fill that gap and give people the confidence to carry on after their state-led cardiac rehab, and to carry on with exercise and get back to doing normal activities and feel really good about themselves. So I'm really passionate about really getting people their confidence back, in particular with exercise.
Do you find that these regular visits that you're structuring with these patients are part of not only moral support, but accountability to make sure that they stay on the right path? Because it is easy to return to old habits that may have got them in the wrong place in the first place.
Yeah, absolutely. And it's a little bit of an ongoing joke, but I've become part counsellor, part friend, part slave driver. So, it's sort of mixing them all together to say, right, you have to turn up at least once a week. Some people do more often, some people do less often, and they're just checking in with me every now and then. But I have a little homework book for them, and I fill it in with what I'd like them to do throughout the week. And that might be, depending on the stage they're at, they might just need to do a 10-minute walk every day. And then for other people, it might be, significantly harder than that, depending how far down the line we are. But yeah, absolutely. The accountability definitely helps, and having someone be your cheerleader and having someone check in on you every week to say, oh, this happened this week. What should I do next time? I was walking up a hill and I felt breathless. Did I go too fast? What should I do next week?
So do you find within the groups that you take who run through your course, do is there a lot of interaction between the individuals participating? Do they support each other as well? And is that a valuable component of rehab to your thinking?
So at first I didn't have that component, and it was all one-to-one work. And people really loved that, and they got the benefit, and they really felt listened to in comparison to the group classes they may have been to in the past. But once we were a few weeks or months down the line, what I felt was missing was that group element. So I did set up a local group. So we meet once a month, and there's between 20 and 30 people a month come, and they have a little chat and a cuppa. And then, you know, I give a speech about a different topic, and then I try and get guest speakers along every month as well.
That's fantastic. A nice cuppa with 20 or 30 people on a regular basis sounds like a really good get together. Yeah. So I'm sure they love it.
Exactly. It's a nice place for them to chat about, you know, all my medication and this, you know, this has happened and my doctor this, and, you know, like, even if it's, we're not giving medical advice, we're there just to sort of have a bit of a mutual chat about our own problems, because sometimes your family doesn't understand.
Certainly, I would imagine that for individuals, it must be nice to know that they're not alone traveling this particular path. So there's strength from others' experiences, and surely the interaction gives support both ways, I would think. Yeah,
and there's that moral support as well. We've got a guy who is now running 10K every week, and, you know, he's our inspiration, because some of us are at the beginning of the journey, and he's, you know, obviously quite far down the line, and just listening to people, how they've been through so much, but there is another side, and you can come out, you know, stronger and do more again.
So one of the things that intrigues me a bit is obviously men and women are affected by coronary or cardiac disease, whatever it may be. Do you, in your experience, do you think that men and women travel a similar path, or do they have different journeys?
I'd say they're fairly different, and it depends, obviously, personality to personality and how they got to the place that they're in. And but I find that the sort of more, the men in particular are sometimes a bit more pragmatic, sort of tell me what to do and I'll do it. Whereas the women maybe need that more emotional support, the encouragement. They may not have exercised for many years because they've been looking after families, they didn't have the time, and they may have never prioritized their own health. So sometimes it's getting the women into the healthy habits, and that can be, you know, a challenge, because they're still looking after grandkids or kids or working. But in terms of the differences in, like, their journey, I feel like women are a bit more shocked, perhaps, that they've got a heart problem. The men can sort of blame a few things. They say, yeah, I've been drinking and eating and not exercising for a few years, whereas the women tend to be a bit more shocked that they've got this diagnosis.
I think my experience is fairly similar. Blokes will put up their hand and recognise where they've maybe strayed off the healthy path. I think sometimes I see men display a bit of depression after their events more obviously than women, and I think that men, at least in my own experience, are sometimes confronted by that inability to take on everything in the world, and I think that knocks them a little bit emotionally at times. But it's interesting to hear your thoughts about that.
I totally agree with that too, and I feel like having me as that ear, like I said, I sort of turn into a counsellor. That's often more the men than the women, because they don't have the they don't want to worry their wife or their children or their, you know, work colleagues. But here is a bit of a safe space to open up and say, do you know what, I'm quite scared.
Yeah.
And I'm not so sure about myself anymore. And it's sort of building them back up again.
So, Angela, one of the things that I think is a priority is seeing the significant other half. So if it's a woman having her husband or partner in, if it's a man, having his wife or partner in, so that we have everyone on the same page. In your rehab, do you engage the partners in the same way? What's your thoughts about engaging the partners?
Yeah, it's a great idea. I do get them in at the initial assessment if they're both happy to come along and they both want to. But then during the exercise, not so much, only if the partner really wanted to, or whether they were a bit worried about things and they wanted to just check in and make sure, it was a safe environment. But in the support group, so the monthly support group, a lot of partners come to that. They like to meet other partners. They like to have a chat. They like to ask me lots of questions. And they like that reassurance that, this seems a safe space and she knows what she's talking about. Perfect.
And it makes perfect sense because they can have a cup of tea as well. So a win all round, I think. Exactly. Look, one of the other things that intrigues me is the rehab from two very common interventions. One is stenting and one is coronary artery bypass grafting. Now, I've got my own thoughts about the rehab process after those, but I'd be interested if you think there's what you see as differences or not, or similarities or not, after an individual's had stenting or bypass grafting. And for those who are listening who may not be sure, stenting is when we put a little spring inside the artery to open it up, a small little structural, architectural device, if you like, all done through small tubes without any major surgery. And coronary artery bypass grafting is, of course, major surgery where we open up the heart and re-plumb the arteries. So a significant surgery. Over to you, Angela. What do you think about the differences or similarities?
So first, I'll start with the similarities in that usually they get referred to their NHS, which is our health system rehab, after about 6 to 8 weeks. But often by the time they get there, it might be slightly longer than that. So they sort of all turn up at the same length of time after their procedure, whether it be stents or bypass. And they do the same sort of exercise and they do the same talk. And they do the same, heart rate monitoring. And for myself, when I'm seeing people, I always start with an assessment. So that would be the same for both. And I would always start them with a little exercise test to see where they're at, and tailor, the exercise, the heart rate zones that they should be exercising at around that. And sort of building them back up. I like to say it's a fitness pyramid. And the very first foundation of that pyramid is their walking. So getting them both doing more walking, building that up gradually, then adding the harder exercise on top of that as we go and we get gradually more difficult. In terms of the differences, I'd say it obviously depends person to person, but the bypass patients tend to have bit more pain and a bit more fear around using the upper body, more discomfort in terms of moving around, and there's a lot stiffer in terms of their shoulders droop forward because of that protection mechanism. They may have had to sleep in an armchair or in a recliner chair, so they've got a lot more postural issues. So we do have to work on that, and then the confidence to be able to use their upper body. Obviously we start gentle and we move on as the weeks progress. And with the stenting patients, because they can't see it, I would say there's a lot more psychological issues with the stenting patients. They can't see that they've been fixed, whereas with the bypass patients, they sort of do have that, I'm a bit safer to exercise, I've been fixed, but it's the pain and the discomfort to overcome and the lack of sleep. Whereas the stenting patients are sort of, oh, am I okay? Can the stent collapse? Is it really in there? What about the arteries they didn't stent? So I feel like the psychological issues are a little bit more on the stenting side.
Yeah, that's interesting. I completely agree. I see similar responses from my own patients. But one that sort of sticks a bit in my mind is that the magnitude of the intervention, as a cardiothoracic surgical procedure is a big deal. And I think my observation to a degree is also patients are more likely to change more to make sure that doesn't happen again to them. Whereas I do have some patients who I have to say, I think they're a little bit guilty of breezing in one day with a whiff of chest pain. They get a stent and they're back on the road and they don't really think that too much has happened. They don't actually realize they got very, very close to the edge of the cliff and then walked away from it. So
that's a really good point as well. And yeah, that is also sometimes down to the doctor. So a lot of people don't have that fear put into them of like, you do need to change. And there's only so much that someone will do with me telling them that. So yeah, sometimes it is that they're a bit more lackadaisical about it, aren't they?
It's a tricky one. You don't want them fearful, but you also don't want them complacent. Look, we're going to have to come towards an end, but there's a couple of things I do want to ask you. If you've got 3 main goals, 3 aspirational goals, or 3 golden rules, or 3 tips for your rehab patients, what would it be, Angela? 3 tips.
So number 1 is go slower than you think. So by that, I mean, I want you to be a tortoise, not a hare. People sort of come saying, I'm getting breathless, I'm feeling tired, I can't do this anymore. And I say, well, do it slower, which can be frustrating, but often by doing things slower, stopping smelling the roses before you keep walking, that will gradually build up their fitness. So always go slower than you think you should. Even if you're already slow, go a little bit slower.
Number 1.
Number 2, take 1 step at a time. So don't worry about the end goal. And this could be whether you want to lose weight, whether you need to get fitter, whether you want to get back to work. You've got to just take 1 step at a time and think about, what do I need to do today? So that might be your 10-minute walk, or that might be, next week's a 15-minute walk and the week after's a 20-minute walk. But just worry about today. So 1 step at a time. And thirdly, get some support. So having a really good support network. So someone like myself, in your corner, who's saying, come on, you can do it. Let's try something else this week. Let's do a little bit more. It could be a partner, could be a friend who's a walking buddy who you meet up with every week. Could be the dog who drags you out for a walk. But getting some support would be really key to keep you motivated and keep you accountable, like we said at the start.
Oh, I like that. So little steps. Don't be overambitious on your goals. Go slow. Little steps on your goals, and moral support makes perfect sense. Look, I'm going to ask you to indulge me with one last thing, and I would love if you've got a great cardiac rehab story that you'd like to share, and then we'll pretty well wrap it up.
So I'll talk about one of my guy patients who had full open heart surgery and his aorta repaired. So he had bypass and his aorta repaired. So it was all of an emergency. And he was very shocked by it. So he rushed off to hospital. Next thing he knew, he woke up, he was in intensive care, spent a good week in hospital, came home, did the NHS rehab, and then sort of fell off that rehab bit. Like I was saying, there's not that much support after you finish those classes. So medically, he was quite stable. His doctor had sort of said, carry on, you can go back to work if you want. But a lot of things mentally weren't quite there. He'd lost his confidence. His family said he was cranky all the time. So he came to see me. He was probably about 4 months post-bypass by then. And a lot of what we worked on was his confidence to do it. So whilst he'd been trying to do some walking, like I said in my tips, he'd been going off quite fast. You put the trainers on out the door, get to the end of the street, feel knackered, and end up going home a bit depressed about that. And I said, we need to slow down. So that was obviously my first tip, slow down and you'll be able to get to the end of the block. And then come home, and then the next week the end of the suburb, and so on. And we built it up more slowly than what he probably thought he should be doing, but by going slower he was able to do it for much longer. Secondly, we worked on his mindset. So he was really afraid, and this is not something he said sort of out loud, but it's what we got to the bottom of is, I'm afraid that I'm this old man who's not going to be able to contribute anymore. And that took a lot of work, and he obviously worked with a counsellor as well during this time. But that was really key, is working on the mindset to say, look, you are still funny. We still got, plenty to contribute. He went back to work. He still, we had to encourage him to go out with friends again to get his sort of old personality back. And just the realization, I think, for him that he wasn't a write-off. I think that was really key to say, hey, there's still plenty you can do and plenty can contribute. So those first few months, I think, were really crucial for getting his confidence back. So at the moment, we're doing lots of fun stuff now. We're doing boxing every week. We're doing some resistance exercise. He's loving his walking now. He's doing 12,000 steps a day, whereas previously hated walking, hated exercise. So I think that's massive progress. And the key thing is that he took it slow. He listened. He did the homework. He got gradually more and more, walked further and further each week. And now I wouldn't say he loves exercise, but I would say he turns up, he does the work, and he's got his confidence back.
Well, he's a perfect example of how the surgery isn't the fix for the whole lot. It's only the beginning of the journey of restoration of health and cardiac rehab. And what you've given this man is you've actually continued that therapeutic journey for him. It's a beautiful story, Angela. Thank you so much for sharing it.
No problem.
Look, I am going to wind up there. This is probably a podcast that's been done in two parts, because we talked far more than I thought we were going to, because it's been so great sharing information with you, Angela. I'm going to thank you for joining us. Say goodbye.
Fabulous. Thanks for having me.
All right. So I'm going to wrap up there. I really hope you've enjoyed this interview with Angela Hartley, a cardiac rehab nurse who runs her own business in the United Kingdom. She's obviously got some absolute pearls of wisdom. It's been a pleasure sharing with you. I've learnt from you. If you have any queries or questions, please drop me a note at info@drwarrickbishop.online. And thank you for sharing today. Take care. Bye for now. I wish you the very best. And as always, don't die from a heart attack. Goodbye.
You have been listening to another podcast from Dr. Warrick. Visit his website at drwarrickbishop.com for the latest news on heart disease. If you love this podcast, feel free to leave us a review.